Okay, on behalf of Helen, Victoria and myself, hello and welcome to our November presentation on our work in NHS England and NHS Improvement to support a COVID-19 programme that was called Beneficial Changes Network. So what we'll do first of all is explain a little bit about the Beneficial Change Network before we then look at the specific knowledge actions that we undertook in the work. So starting in approximately May this year, just as the initial COVID-19 lockdown was ending, the Beneficial Change Network formed, and its intent was to capture the incredible ways that staff in health and care responded to the pandemic, innovating and collaborating to ensure a continuing safe and effective delivery of health and care in unprecedented times. So the network's purpose is to harness, capture and share the experiences of all those that were involved, to evaluate the changes that occurred, and ultimately to support embedding the high impact changes across health and care to the benefit of all. So the scope of the network is wide. This is what we call our rainbow diagram, and it demonstrates that the network covers primary, secondary and community care, mental health, patients, carers, the public, as well as staff. There are enabling areas such as digital, commercial and procurement, and it also takes into account the impact on the environment with Green NHS as well. As you'll see towards the bottom of this diagram, there are a number of cross-cutting knowledge-related actions for the network, and those include capturing and sharing stories, building an evidence base, and developing a community of practice. And we'll talk more about those in a moment. So just to reinforce that sense of wide scope of the work, this is a map of the stakeholders of the network. So that includes national bodies, regions, local systems, think tanks, patients and public, interest groups, and clinicians. So hopefully that gives you a good sense of the scope of the Beneficial Change Network. So what we'll do now is begin to focus on some of the knowledge actions that we've undertaken within the network. So this is a model of the work that's been undertaken in Beneficial Change Network. It starts with supporting the work streams that we saw in that rainbow diagram to identify and prioritise their beneficial changes. So work streams have approached that in a number of different ways. Some have conducted surveys of their stakeholders, and others have hosted virtual events to discuss what changes occurred. And that picture of prioritised changes, as that emerged, our primary role then as the knowledge team was to support detailed reflection of what happened, as well as to support the central premise or ethos of the Beneficial Change Network, which is to engage, communicate, share and learn. And we'll look in a moment on how we set out to achieve that. But with that knowledge phase being embedded within a cycle of continuous improvement for the network, we think that was really important to us as a knowledge team to see that our offer was integral to the programme. So what have we actually undertaken then as a knowledge team within the Beneficial Change Network? So our work can be grouped into 5 areas. So that's evidence, knowledge sharing, collaboration, capability building, and then capturing stories and narratives. So I'll hand over to Victoria, who will describe the first 2 of those.
Hi everyone, I'm just going to talk for a couple of minutes about how we've captured external evidence and then shared that back with the network. And gathering evidence from external sources has been an important part of our contribution to the Beneficial Changes work. So since June, we've been scanning over 60 sources to capture examples of changes, innovation and improvement that have taken place across healthcare systems. And that includes some traditional sources such as journal publications, but more focused on some grey literature, website content, blogs, reports and publications and analyses, commentary from health leaders, so a wide range of sources, and we're happy to share that list of sources if anyone's interested. So as you can imagine, that's been a huge undertaking for us, and we produce, as a result of all that scanning, a bi-weekly evidence scan, which includes content such as local examples from NHS trusts where they've made changes, reports from national organisations, commentary and analysis from health leaders. Where there's knowledge sharing activities like webinars as well, we also signpost those. And there's the occasional piece as well from outside healthcare. So for example, around sustainable change or learning systems, we'll include that as well. And it's fair to say so far that the evidence base is emerging. So we're seeing a drive to identify lessons learned and a desire to embed those. But at the moment, it's still too early really to see any evidence that's using robust research methods. When we share the evidence scan, we produce that as a PowerPoint file, and the content is organised, as you can see on the slide here, in sections, and then we as well the content. We've tried to produce this and make improvements as we go along, get feedback from colleagues, and so we have thought carefully about how to share this with the network in a way that's more meaningful, adds value, and is a bit more digestible for people, because we are mindful of how busy people are, but also how much content is in there. I think our last evidence scan was over 35 slides, so we are conscious of not wanting to overwhelm people. So once we produced the first few PowerPoint files, we decided to try to record a podcast format with visuals, so a video cast, to accompany the slides so that we could make the content more digestible for people. And we added some of our own insights too around the evidence. And it was also an opportunity to promote the network. So now the full evidence scan, the file, the PowerPoint file, is published on the NHS Futures platform, which we'll mention in more detail shortly. And alongside that, there's an accompanying 10-minute video cast. We also now produce a quick 2-minute video cast, which we prepare especially for Twitter. We use that as a preview or a taster of for the full evidence scan, and use that to encourage people to join the network. And our first Twitter video cast got over 1,700 views, so we were quite happy about that. So a couple of our key learning points around the evidence and knowledge sharing part of this work. We found that including a summary of the evidence in our PowerPoint slides added value to that product. We found that sharing knowledge in a more creative and novel format, although it felt a little bit uncomfortable for us at first, was definitely worth the effort. We've had some really positive feedback from that. And a personal reflection from me is that being immersed in the evidence, having to summarise it and then having to talk about it, has enhanced my own understanding of the evidence base in this area, and certainly on a day-to-day basis allows me to contribute more meaningfully to internal conversations. And that's it from me.
Thanks, Victoria, and hello everyone. So I'm going to talk about the work that we've done, which has been to lead on implementing an online community for the network. I'll explain how we set it up and our learning points. So firstly, how did we set it up? Well, we set up an online space using Future NHS, and you can see the homepage on the slide and the narrative section. Futures is a widely used collaboration site, very simple to set up a workspace, and we also had support from the Futures team to guide us. We set up a simple navigation to meet the needs of the members of the network, and the sections include a discussion forum, an about page, practical guidance page, which includes the knowledge management approach, and the published evidence section. And over time, we've added more content, such as narratives, which has a tag cloud to aid access to content, which you can see to the screen. And we're using the Futures case studies tool, and I've also added a weekly newsletter. In terms of our learning points, well, we've attracted nearly 500 members to the site from a range of roles and settings. And behind the scenes, we set out expectations in a content plan. We've also set up regular huddles to keep an eye on tasks and issues, and we've given a member of the KM team responsibility for dealing with membership requests so that we can provide a responsive service. Using Future NHS has been really positive, and it's given us a greater understanding of other COVID-related workspaces and communities, which are great sources of learning. And we're continuing to encourage active engagement on the site via the forum. And you are all very welcome to join. You can email the KM team or use the link that's on the bottom of the slide. Moving on to the next area of our work, which is around capability building in terms of lunch and learns. So we've supported a range of lunch and learns for the network. You can see them described on the right hand side of the screen. And we've run 5 sessions. So a session introduced members to the network. We then ran a series of further sessions, including ones on lessons learned and retrospects and creating knowledge assets. We ran another session around telling the story and creating case studies with our evaluation colleagues. And they also presented at a session around capturing unintended consequences and understanding attribution. And then we brought in some further people from the network to run a session on co-production with people with lived experience. And so the knowledge team did all the planning, liaising with speakers, we sent out the invites, we hosted the sessions on Microsoft Teams. And in terms of our learning points, well, we've been able to build on our prior experience of running learning sessions. So we were already familiar with Microsoft Teams. The feedback has been really positive and we've had high participation. And members of the network have been able to learn together during the lunch and learns. The calm and friendly facilitation really helped, and so we've used polls and the chat function to encourage participation. And we're planning further sessions really to bring to life the learning from narratives and case studies. And you can see all the recordings of previous sessions via our Future NHS sites.
Okay, and finally, in terms of narrative, so we wanted to provide a semi-structured way for the work streams of the network to describe their stories of change. Work streams were free to use their own template, but we developed one just in case for work streams who kind of primarily to focus on describing their stories and not worry about the structure. And so as you can see, for a give them beneficial change, our narrative structure asks, so first of all, what happened? And then there are some supplementary questions there for work streams to describe when did you change, who was involved, how did you change, what challenges did you face, and what successes occurred. And then secondly, why did you change it, or what compelled the change? What was the impact? And there are prompts there to consider that question from a number of different perspectives, including patient outcomes, patient experience, staff experience, productivity, health inequalities, and green NHS. And then finally, how will you carry forward that change and embed it for the future? We've had a lot of really positive feedback about this structure and a lot of good use of that structure, and you can go and have a look at some of those examples on the Futures website that Helen has just described. So hopefully that was a helpful overview on how we've delivered the knowledge phase of the Beneficial Change Network. So just to close out and to reiterate what Helen has already mentioned, you can go and access all the work that we've described on our Beneficial Change Network on the Futures collaboration site. But equally, if you'd like to get in touch and learn more, then you can drop us a line at the email address on screen. Thank you very much.